Hello and welcome to Afternoon Tea with Docs. I'm Dr. Linda, emergency medicine physician from Sheffield, and I'm here with my lovely co-host, Dr. Erica, who is a GP from the West Midlands, and we are both board-certified lifestyle medicine physicians. If you're new to us, well, welcome. We are here every Sunday at 5 p.m. UK time, bringing you the most up-to-date, evidence-based lifestyle medicine so that we can help you bust misinformation so that you can live a truly long and fulfilling life, chronic disease free. Now, if you join us here on Zoom, you're able to chat with us after the interview, which is live streamed, and you're able to ask your questions personally and have more or less a virtual consultation with us, which is non-official. If you are happy to help us out, you are welcome to donate on our website, afternoonteawithdocs.com/donate. Every single event is free for everyone and will always be so that everyone can gain health.
Today we're speaking to Deb Teale about her own journey, which is absolutely remarkable. Debs is an advocate of creativity in health, following her own remarkable journey. Having been in the mental health system for most of her life, it took an art class to totally transform her life. She now advocates creativity as an additional service to improve well-being and offering hope and aspiration. She has completed a master's in mental health recovery and social inclusion, and believes recovery should be a part of everyone's care package. She is a trustee for the National Centre for Creative Health and also a member of the Social Prescribing Network. Debs often does talks on her journey, and this has taken her to the NHS Expo and as far as the World Health Organization in Helsinki. She has a passion to promote everyone having a voice and a choice in their own care, something she feels lacked in her own journey. Debs believes everyone has something to bring to the table, even if it's just themselves. Welcome, Debs.
Welcome, Debs.
Thank you. Nice to be here.
Well, great to have you here. I was just saying that every time I read your bio, I feel so inspired. And we met in June last year, 2021. And when I heard your story, I just knew that more people just had to also hear your story.
Thank you. I don't think it's that remarkable. Well, I don't know. I think it's remarkable in some respects, but it's almost like it's a different person.
Yeah. So, yeah, I mean, your journey started in your childhood, and I've heard you refer to yourself very often as a service user, an invisible service user, and now an ex-service user. So can you take us all the way back to your childhood and talk us through your journey?
Yeah, well, the first GP visit I had was when I was 8. I just woke up one day and felt really shaky, uncontrollable crying, didn't know what was up with my mum didn't know, so we went to see the GP and I was diagnosed with having bad nerves, which was what they thought then days. Everybody had bad nerves, nobody had any sort of specific condition. If I was to go with the same thing now, it would be classed as a panic attack. But in those days, it was just constantly bad nerves. And that started off the journey of me having lots of time off school because I didn't feel well. I was often shaky, unable to function properly. And it continued into adulthood, and the medication just got more and more to a point where, well, about 11 years ago now, I was on 21 tablets a day. I was often bedbound because of my illness and because of the side effects of all the medication that I was on. I've been medically retired from my last job because of my mental health. And I've just lost my mum. And the psychiatrist said to me, "You're always going to be ill. You're always going to be medicated and you'll never work again." Now, he was the expert. I looked to him for advice and guidance. And here he was telling me that this is the best my life's going to get, when I felt at rock bottom. So to me, I'd been given a terminal life sentence, which I didn't particularly want to live with. And I took an overdose. I felt such a burden to my children, to my partner, to my friends. I felt they all deserved freedom from me. I felt they all would be a lot happier if I wasn't around. And I woke up in hospital absolutely livid that I'd woken up, that I'd failed. It was such a big failure to me. And I felt like I'd let my daughters and my partner and my friends down again. I felt that I'd caused them even more pain and suffering by failing. And I was in the hospital bed opposite a lady who was dying of cancer, and she had a wonderful palliative care plan in place. And I was jealous of her because I saw her getting a positive end to her suffering, and yet I was being forced to live with mine. But people didn't see what I was going through as suffering. It was just, oh, well, she deserves it. She's attention seeking. And there were some really nasty things were said to me at that point. But I remember hating and despising myself far more than what anybody else on that ward did. And it's sad to say you're jealous of somebody who's dying, but that's how I genuinely felt. Anyway, part of being discharged from hospital was that I was referred to psychology for an assessment. Great, I already felt a burden, so more services made me feel more of a burden. But I went along because that was part of being discharged, and I'm sat in the waiting room and I saw this crumpled bit of paper. I don't know why I picked it up, but I picked this piece of paper up and it said Creative Minds Art for Wellbeing. I'd never really done art before, never been any good of it. My daughters, I were the butt of the jokes when we played quick on the draw, but something made me pick that leaflet up that day. And when I went in to see the psychologist for the assessment, I said, what do you think about this? He didn't know a great deal about it, but he said, just give it a ring and see what they say. So I rang them, and it was literally 10 minutes from my house. My friend offered to take me. It was a few days later. So I went along to the art class. My friend dropped me off and I went in. It was a massive old mill building, which is popular up north. And I went in. It was really big, hollow, echoey building. And I was about to turn around and run when this gentleman with a beret and a cravat stepped back and bellowed, "Come in!" And I thought, oh gosh, I dare not come in at this stage. So I went down and I sat at the seat nearest to the door, ready to bolt if I should need to. And the art class started. Nobody needed to introduce themselves. Now, having been in the mental health system, you're judged all the time. So it was good that I didn't have to introduce myself and say I'm this or I'm that. So we just got on with the art, and it was a mix of people with mental health issues and people without. It was like a mixed class. So nobody knew who was there because they'd been referred or who was there because they just had an interest in art. And at that art class, a little flicker started in my stomach, and I started to feel I had something worth fighting for, that there was something better could happen. And I remember that night running home with this picture that I'd drawn at the art class, and my children just, they didn't believe I'd drawn this. It was a teasel. And they didn't believe me, and I had to draw it again in front of them just to show them that the art teacher hadn't drawn it and I was taking all the credit for it. But I was so eager to go back the next week, and I wanted to do more of the art class. Something just came alive within me, and I was just obsessed with art, and I wanted to do more and more. And then I started painting, and life really changed with paints. It was so vibrant and colourful. And at this point, I often say it's like I got new eyes in my body, because I was seeing things differently, both metaphorically and physically. And where I'd lived there for 26 years. And I remember walking along the canal. It was next to a canal. And one day just being in absolute awe of the beauty of it. And I'd been there so long and never noticed it before. Walked on that canal many a times. And it was really sort of inspiring to me to see all these beautiful colours and textures. And so I wanted to bring them into my paintings. And, you know, I looked at all the different colours and started, I mean, I'm obsessed with landscapes because I just love the colours and the vibrancy and the depth and all the different textures and different signs and ways that they are. So I started doing the art, and for the first term of the art, it was fully funded by the NHS. Then the second term, it was part funded by the NHS, and I had to pay for the other part. And at that point, I was a single parent on disability benefits, and I didn't think I deserved it still. But one of the other students in the art class saw the difference that had happened in me long before I did, and she paid for my part. She said, "You can't give up now." And I'm ever so grateful to her for doing that, for investing in me. And, you know, it's been like, for somebody to have that faith in me when I was told by the psychiatrist, you're always going to be ill, you're always going to be medicated and never work again, for somebody to suddenly see something different in me. And it was in the second term that I started thinking, actually, I'm feeling a lot better. And that's when I spoke with the psychiatrist about coming off some medication or lowering it. And it took me just over a year to come off all the medication, and I had to cut tablets in half and limit this and then wait 6 weeks before I started on the next. It was really structured. I wouldn't advise anybody to just stop taking the medication at all. It was a really structured way of doing it. And the hardest part was the thoughts and feelings that I was having, because I've been medicated all my adult life. So I'd been numbed to the way that these thoughts and feelings were affecting me. And it was really difficult. And I remember thinking at one point, I need to go back on medication. It's too difficult to deal with all these emotions that, as an adult, I was having to deal with, when normally you deal with emotions through puberty, don't you? And suddenly there was all these emotions, but I persevered, and I'm really pleased that I did. I started doing talks initially to other service users at the art class because I felt I had no hope and aspirations, and that doctor's telling me this is the best my life's going to get. I need to tell other service users that they're not necessarily the experts. We're the experts, and we need help unlocking that potential within us. So I started doing regular talks at this art class to other students who were interested in looking at different ways to treat the mental health. Then the experts asked me if I'd do a talk at an expert session, and I'm like, gosh, what can I say to them? What can I tell them? And I learned pretty quickly that they were learning quite a bit from me. And what they were learning from me was the human side. And I'd always felt a service user. I've always felt a patient. I've always felt a patient number. I've never really felt like I had an identity or a purpose. So suddenly people were using my name and asking my name, and it validated who I was becoming. And I wanted to sort of share that with everybody else, both people who were using services and these experts. And I don't care who you are, I don't care what labels or numbers or letters you've got before or after your name. Nobody knows what it's like to be us. We are all experts in ourselves, and we all need help to find that expertise within ourselves. You can go learn about the condition I've got, but my condition would be different to the next condition. You know, we need to really be supporting people to look at how they work with their conditions and how these experts work with us to deal with our conditions in a different way. So roll on a bit, and I'm doing these talks. Like I say, I've done 3 talks for NHS, oh gosh, what they call it now, World Health Organization, that's it. And I've done thousands of talks up and down the country. I've done 5 abroad.
Can I just interrupt a second here?
Yeah.
And after one of these talks that you've done, you were even invited to have tea with the Queen. And what happened?
I turned it down. Now, I turned it down because, having been in the mental health system all my life, people have always taken the mickey or had a go at me if people don't understand Yorkshire twang. So I just thought he was joking. I didn't think he was serious. Because after I've done talks, I get people come up and some want a hug and some want to just tell me their story. And this quite well-dressed gentleman came up. He says, "I'm really inspired by your talk. How would you like tea with the Queen?" And I just said, "Oh, no, thanks. I don't drink it." And the look on his face, and he said, "That's not the correct protocol." And I thought, oh, what's he mean here? So I realised he was being serious. And I mean, still, right up until in the queue at Buckingham Palace, I still felt there was somebody going to say, "Actually, it's a joke, get out." But yes, I went and I had apple juice. I didn't have tea. So yes, I had and I've been to Clarence House, and I've won awards. I've been shortlisted for Yorkshire Woman of Achievement. And I don't say that to brag. I say that because I've been an invisible service user most of my life. These things weren't even a dream for me. They weren't even anywhere near possible. And I want to say to people, anything is possible. I used to say the sky's the limit, but now I say the sky has no limit. You can go further than you ever dreamt. You can go, as far or as near as you want. And I advocate for people to have a voice and a choice in their care, because that's something I never felt I had. I always felt that I had to conform. And I always felt, because I remember when I was sectioned once, you would call it a ward review, but it was very different then. I mean, it's quite a few years ago now. And there was a load of people in there. I only knew 2 people's faces from the ward. I didn't know anybody else's faces. I wasn't allowed to take anybody with me. And I went in and said, "Right, we're going to do this, this and this." And they wanted to increase some medication. And I said, "But I don't want that medication increasing because the side effects are horrendous." And from there, I was labelled a troublemaker. They increased the medication anyway, and they gave me more medication to counteract the side effects of the medication that I'd been complaining about. So you learn to sit down and shut up. You learn to sit down and put up, because you have to, or you'll never get out of hospital if you don't. And I liken my journey to being in a car. I've been a passenger for most of my life. There's always been somebody else in the driving seat, and I've never had a say whether I go left and right, here and there. It's just always been, this is where we're going, shut up and put up with it. Whereas now I feel I'm in the driving seat and I'm driving this car wherever I want to go, with whomever I want to go with, and whenever I want to go. It's never been somebody else who is in charge of my care or my future or my life, unlike the previous places that I've been. And when you're driving in a car, you look through the front, the massive windscreen at the front. So you're looking through the windscreen because you need to know where you're going. But it's important that you look through your rearview mirror to check where you've been, to check what's happened. But if you stay there, you will crash. So you've got to keep looking forward. You've got to keep being aware of where you are and what you need to do and where you need to go. So that's what I say to people, because it's easy to be trapped in the past. Now, my background, I know I went to see a GP when I was 8, but I was abused by my dad, and quite badly abused in many ways. And it was natural to me. We didn't talk about family stuff in them days. It was almost fashionable to be a victim of domestic violence. You know, my mum and her friends would take great joy in wearing sunglasses in the winter and scarves in the summer, as a, you know, that almost, you know, like, oh, my husband's beat me up type of thing. And it's very different to what it is now. I would say it's very different now, but that's how it was then. So to me, that was a normal environment. So then I met and married a man who continued that abuse. And to me, that was normal. That was just how life was. That was who you were and who you were meant to be. And I didn't know any different. So I to me, that was just normal. When it's quite ironic, really, because my ex-husband, I found out many years later, after we got divorced, that he'd colluded with his boss to get me sectioned to claim benefits for me. And it was like I was mourning a marriage that I'd been divorced from all this time, because to me it was a marriage, whereas to him it was a plan. He had a bigger plan in his ideal. And although I was mourning my mum because I'd lost my mum, I also felt I was mourning this marriage that I'd been divorced from all these years. And I had 36 years of abuse, of people telling me what I can and can't do, and who I can, you know, who I am and who I aren't. And a really defining moment for me was when I was at the art class. I put all my artwork up on the wall, and I was just looking at it one day, and I thought, gosh, this is weird. What am I feeling here? And this little voice said, pride. And I thought, yeah, I am. I'm really proud of myself. I'm really proud of the work I've done, you know, and where I've come from and what I've achieved. And it was really strange to suddenly feel pride in myself when I've had 36 years of being told how worthless, useless and terrible I am. So it was good to sort of define that moment and think, you are wrong. I'm right, I'm here, I'm really proud of myself, I'm proud of the journey I've come on, despite what you've put me through. You know, and it's about, I can't change the past, like I was saying, you know, looking through the rearview mirror, but I look through that windscreen, I reflect on my past, and my past has made me who I am. And for the first time in my life, I'm really proud, I'm really happy. And, you know, I do the talks that I do, and I try and support other people, because I don't want anybody to get to the point that I did, that I felt a burden to people, that people were better off without me. You know, and it's easy for people, because I've done lots of voluntary work all over to try and share mental health feelings, and you know, people have a bit of open aspiration. And one of the places I worked, volunteered in, was Yorkshire Ambulance Service. I'm from Yorkshire, if you didn't know, anybody on the call. And I was talking to them about mental health and what they did to support mental health. And I asked them what they did for people who were in crisis. And they said, oh, we always say, think of your family. And I said, well, don't. I was thinking of my family, and you're rubbing salt in the wounds that I failed. And she goes, oh, I never thought of that. You know, and I thought, I need to talk more to lots of different people to make them aware of what it actually feels like to live with this condition, to live with these thoughts. And it's really strange, because I have lots of like little light bulb or defining moments, and a particular moment is possibly about 3 years ago now. I eventually married my partner, my boyfriend, after 17 years, so it was about time. And I'd just been to the registry office to register it, and I was on my way home, and this lorry came. he was in the wrong lane, and he clipped the back of my car. So I was his front grille for a while, and he's driving on. And I didn't think he'd seen me. And it was at that point I felt for the first time that I wanted to live. And I'm like, I want to live now, and I'm going to die. And it's quite I mean, obviously at the time it was just, gosh, I'm going to die and don't want to. Whereas for most of my life, I've always felt I deserved to die. I've always felt that I needed to die. So it's quite a defining moment, even though it was quite traumatic. So yes, it was sort of just made me realize how far I'd come and what I'd achieved.
Yeah, and what you just said there about what we say to people in that crisis moment, to think of your family, and may I take this opportunity to share a poem that you wrote when you were in hospital. Did you find your copy?
I did, yeah. Do you want me to read it?
Yeah, would you please share that with us?
So this is what I wrote while I was in the hospital bed, and I'd been saved, to which many people would think, oh, great, they've been saved, but that wasn't how I felt. So this is a poem I wrote, and I'm not a real poet, so you'll have to just make do with it. Wishing this world would take me away from this misery each and every day. The dread and loneliness will not prevail. To wake is an enviable tale. I wish this world would take me now. I am too ill to think of how. I think the world would be a better place if it did not have to see my face. I lie in hospital as I awake. I can't even do that right, for goodness sake. The misery is destined to be the only life right now for me. Think of your children, the doctor said. They are the forefront of my head. They're better off with a decent mum, one who can get up and do the school run. My daughter has to take care of me. What kind of life must that be? I lie in bed unable to live. She is a life that tries to give. Bipolar and depression are very real. This disease inside me is a very big deal. It's all in your head, I hear people say. I know, I live with it every day. Hang on in there, things will get better. I don't know as I write this letter. My heart, my soul, my miserable life. It's day after day of misery and strife. I do not do this to cause you pain. I just want to feel normal and not insane. I want to go away and not come back unless this life can cut me some slack. Depression is a war within my mind. I cannot win, I cannot find. It is just there as I lay in bed, these crazy thoughts going round in my head. I want to live so happy and free, but for now it will just have to be. So that's what I wrote when I was at the worst. And for a lot of people, they think once you've been saved from suicide, that things are better. Well, it's not. You've still got all the issues you had before. You've still got all the problems that you had before. But on top of that, you've got the shame of people knowing that you tried to take your own life. You've got the shame of people thinking she's attention seeking. She's just wanting this. She's just wanting that. I was so angry that I'd failed. I really wanted my daughters to have a mum that could love them. It's really weird when I talk about it, because I think now it's 12 years since I lost my mum, and I know my heart still aches for her, and I could have done that to my children. But at that time, I just couldn't think straight. I just couldn't think in a rational way. To me, that was the only way out. That was the best thing for everybody to do. And that I felt a failure for not being able to do that right.
Yeah, I think that poem just really reflected your mental state when you were lying in hospital. And I think for any healthcare professionals listening or watching this episode, we really have to be mindful about the words that we use and what we say. And, everyone is different, and there is absolutely no one size fits all when it comes to this. And what works for one person may not work for another. you mentioned about your daughters being your carers, and not long ago you saw your eldest daughter graduate from law school.
Yeah, well, my youngest daughter graduated.
Oh, your youngest daughter.
With criminology and sociology as well. So I'm ever so proud of, I mean, I know all parents are proud of what the children achieved, but because mine have had such a lousy start, it's a miracle that they're all as sane and sensible as they are. They're all really successful. They're really stable as well. I mean, I know they have a few hiccups. I know life isn't straightforward for anybody. I know that, but they get on with things. They do things. And I think, you know, when they've seen the journey that I've been on and they see the things that I've accomplished, and I never imagined I didn't think I'd be alive, if I'm honest, but I never expected to accomplish half of the things I have. When just sort of going back, when I was talking to Yorkshire Ambulance and she asked me, what can we say? And I said, just ask them a question. What's brought them there today? Just sort of say, why have you got here today? What's happening? Because it might be the family that's brought them there, but not in the way that people think. And I think if you ask people questions, it takes that suicidal ideation away from them for that brief second. It might not completely go, but they'll have to think about what you've said and will take you, you know, away from the thought processes that they're thinking of. And we know they're not rational thought processes. Now, people say to me, what was it about art that worked? When, I mean, I've been in services, I've had loads of services, I've had everyone going, you know, counselling, CBT, DBT, everything. And people say to me, what was it about art that worked? And the way I can describe it is, I use a lot of analogies, so you'll have to excuse me, but I think it helps people understand that. When you go into a coffee shop and you go in and the machine fires up and it's going really loud in the background and it's quite annoying, but you get in the queue and you wait to be served, then you go sit down and it blends in the background, does that noise, you forget about it, and you sort of you just get on with your conversation, and then that noise stops and you think, oh yeah, it was really noisy, but it had been that's how my brain was. My brain is like, it's always been like a racing track. I've never known it to be any different. So to me, that was just how everybody thought and felt. But the art class allowed that racing track to stop. That art allowed it to give me a break. And I felt that because I'd had a break from it, it did it did two things. And the first one was, it made me aware it was there in the first place. And then it made me aware that I could control it rather than it controlling me. So then I began to start controlling my illness. And that's just by putting some colours down on paper or canvas or card or whatever I was using at that point in time. And just something so simple. And I often say a simple art class, it not only saved my life, but it completely transformed it.
And let's just take an opportunity to have a look at the art behind you.
Yeah.
And you've done all of that, haven't you?
Yeah. I've just sold my 162nd piece. I've had an exhibition at Canary Wharf in London, and last year I had a piece in the United Nations International Art Exhibition. Now, if you'd have said that to me 10 years ago, that I would be off medication, I'd be out of services, that I'd have sold art, that I would have been to Buckingham Palace, Clarence House, World Health, I'd have just said, you need sectioning, because it just wasn't achievable at all. Whereas now, these things are. And that's why I advocate creativity, and it's a complementary to other services. It can't replace it, because some people will always need counselling and medication. but I'd like people to be referred to, they call it social prescribing, which is creativity in the community. So it doesn't have to be art, it can be cricket, football, rock climbing, singing. We've even had pigeon racing, because that's a Yorkshire thing. And you know, so it can be whatever creativity you want it to be. It can be ever, you know, whatever means you want it to be, but it's connecting people with things that are there in the community. So it's joining you up so you're not socially isolated, but it's giving you an interest as well. You know, I mean, I still use my art today. I mean, I won't show you that side of the room because that's my art side and that's a bit messy. But I still use my art for my well-being, and it's really important that I do use it for my well-being. I still need to use it for my well-being. I still need to make sure that I'm doing okay. I've still got all the labels, I've still got all the diagnoses, they haven't magically vanished. I still live with them every day. We need to give people a life worth living. And that doesn't mean to say I've recovered. Whether people will say I'm always in recovery or not, I don't know. But I'm living well enough to be able to live a life that is worthwhile to me. So that will do.
And you've introduced this concept of social prescribing, and you've explained it as well. And that's what you went to talk to the WHO about, social prescribing. And obviously it's played a hugely important role in your life, giving you community. And I see Johnson on Zoom today, and Johnson was our guest a few weeks ago, and he said that we heal in community and we suffer alone, and that is so true.
Absolutely.
Community is and community relationships is also one of the 6 pillars of lifestyle medicine, because we know that health is not just about our body. The physical body is also about our mental health and our relationship with others, with ourselves, with our immediate friends and families, colleagues, and also the community that we live in. I wanted to say, for people who want to access social prescribing, and if you're not sure, please do ask your GP surgery, your practice nurse, or your GP about it. And just want to give a big shout out to the social prescribers and the link workers working really hard to connect patients to different local community services. So thank you.
Well, I think because with mental health, a lot of people, when they start to feel unwell, they unfriend. They unfriend from Facebook, from Twitter, from Instagram, they unfriend from life, because they don't want people to see them ill. They don't want people to feel their negativity. They don't want it to be passed on to other people. So they isolate themselves. That's one of the things that people with mental illness do. And by connecting in a different way, that's not focused on your illness, it's just focused on your wellness. You know, do this, have a go, see if it works. If it doesn't work, try something else. But it's focusing on something different. And that was the beauty of it. When I went to the art class, we talked about art. We talked about things that made us feel good. We talked about things that had bothered us that week. We talked about things that, you know, so it was there to connect us in a very different way to what clinical services had. You know, clinical services are very much clinical to start with, but they're very much isolating in that you're tracked by this physician. And I mean, if you do, there's not very well, I never attended any group sessions, but if there are group sessions, it's almost you're all put there because of that, and it's still focused on that illness. And stop focusing on illness, start focusing on wellness, start focusing on what you can do and not what you can't do. You know, it needs to stop being a deficit. It needs to stop being, you know, all the negative of it, and how to work out, you know, what you're bad at. I know when I went to university a few years ago to do my master's degree, which honestly, so many people tried to talk me out of it because I didn't do very well at school. And this course was for people who didn't have necessarily have a traditional degree, and they were wanting people with lived experience on board as well. So you had to review this paper, and I reviewed it, and I was like, gosh, this is really old. Why are we reviewing this? It's up to date now, and this is happening, you know. So they let me on the course, and so many people were so negative about me doing it, and I just wanted to try it. I just wanted to really try and have a go. And if I didn't succeed, then fair enough. But that knowledge could never be taken away from me. The plan was to get as far as I possibly could on this course before they chucked me off for being a fraud. That was the plan. And I passed the first year with merit, and I was like, oh, that's okay. Then the second year with a distinction, and the third year with the distinction. So I got overall distinction. And I almost wanted to rub it in the people's faces who told me not to do it, who tried to hold me back. And I want people to have faith in themselves and to try things, because, I mean, like the art class, what's the worst that could happen? I don't like it. Fair enough, I don't need to go again. I get paint on me, just put it in the washer. You know, when you think of the side effects of some of the traditional services that we have for people with mental health, you can cope with those side effects, you can deal with that, but it's your choice. And if it gives you enough joy while you're doing those, then why not continue doing them? You know, to me, art is a hobby now. It's not just you know, oh, I like painting. It's a well-being tool. It's my hobby to keep me well, and that's where I get immersed. And I paint landscapes after landscapes. I do paint other things. I've just painted a Buddha, and I really struggled with it because I've never done a Buddha before, but it went really well. I've been asked to paint another one, and I'm like, oh no. But I'm going for it. I'm giving it a go, because I think if anything in life has taught me just to have a go. If it doesn't work, I've not lost anything. So just try.
And of all the, you often talk to medical professionals, and I think the psychiatrist who told you that you'll always be on your medications, you were on 21 tablets a day back then, that you would never work again. This is it. This is the best your life is going to be. And now you've exited the mental health service, and you've actually been working in the same trust that psychiatrist has told you that you would never work again, haven't you?
Yes.
You're still working there?
Yeah. Which used to be, it used to be quite interesting on the corridors, is all I'll say. Yeah. But to be fair, he's completely changed his thought process now, and he won't ever say that again. And he sits with a service user perspective at all times, and I respect that. You know, it'd be easy for me to say, oh, he was a terrible, you know, he did this, that, and the other. But again, looking at the positive, I suppose, I thank him for forcing me to speak to the service users, because I felt I had no hope, and I wanted to give service users hope. So I'm almost grateful that he said that, so that I was really to do that, because I wouldn't have ever done that before.
And so now you've changed his perspective, and therefore all the patients that he gets to support, their management and their interaction with him would be forever changed because of your experience and you know, your interaction with him.
Hopefully more positive.
Yes.
And I know when I do talks to professionals, and I use that term sort of loosely, because I think we're the professionals of our own bodies and our own well-being. What I do to psychiatrists and psychologists and people who will section others, I give them a sheet of white paper, ask them to divide it into 6 squares.
Should we do that actually?
Yeah, if everybody's got a piece of paper in front of them, we can all just go and get one.
Yeah.
And a pen, of course. Unless you're clever enough to remember it all in your head. All right, so has everybody got a piece of paper? All those that want to join in anyway. Right, so divide it into 6 squares. They can be as big or as little as you want, but you will be writing in them, so make sure there's space to put something in those squares. Now, in those squares, I want you to put the 6 most important things in your life in those squares. And I will say, it doesn't have to be your family if you don't want it to be, because not everybody thinks the family are that important. So just the 6 most important things that you feel are the best things for you. And for some people, it will be really easy. They'll be able to reel 6 things off. But for people with mental health conditions, they might struggle to find 6. But just so long as you've got something in some of the boxes, that's the main thing. I can't see if everybody's managed to do it or not.
Are we ready? The people who've got their faces showing? Give me a thumbs up. Cool.
Okay, right.
Jason's still pondering.
All right. You don't have to have 6. So long as you've got at least 3, that's the main thing. Okay. Have you got 3? Is it Jason you said? Yeah.
Yeah, thumbs up. Cool.
Okay. So I want you to cross all but 2 of those things off. So you need to leave the 2 most important things in your life on that sheet of paper. So you're crossing 4 off if you've got 6. If you've got 3, just cross 1 off. And keep the 2 that mean the most to you. So you should just have 2 left. Is that okay? Yeah. Right, this is where it gets really tricky. I want you to cross 1 more off. So you've got the most important thing in your life left on that sheet of paper. The thing that you can't do without, that means the absolute world to you. Right, for most people, not everybody, so I'm not judging anybody, you can put what you want, but usually people leave the family, parts of the family, you know, it might be the son, the daughter, the mum, the dad, the aunt, the uncle, or it might just say family in general. Imagine you've been sectioned and that's taken away from you as well. How do you think you'd feel with the thing that means the most to you taken away from you? Now, somebody once had the mobile as the most important thing. And, you know, like I said, I try not to judge, but I thought, oh gosh, I thought it was a bit sad that the mobile was the most important thing. Like I said, for most people, it is the family, but not everybody has a family. So what do we do when we section people? We limit times that family and friends can come and see them. We limit how long they can stay. Now, usually it's your friends and your family that get you through the toughest times because services aren't 24/7. Yeah, maybe the mobile is the way they can connect. And if you're like me, I'm obsessed with playing games on my mobile. but I don't think I'd pick it over my family if it was the most important. If I had to pick one thing in a fire, I'd certainly be grabbing, well, I'd grab my dog before my husband, but don't tell him that.
Too late, Deb, so he's going to find out from today's conversation.
He knows. I keep saying there's 3 in this marriage. Dog's sat in the middle of us, but yeah. So yeah, we limit when we can see people, and because services, I mean, some are 24/7, but the services that people in the community are involved in aren't usually 24/7. So you rely on friends and family. You rely on people to support you and to get you through the tough times when services aren't open. And if we take that away, which is what we do, I mean, when I was in hospital, we had 2 hours a day visiting. Well, if your friends and your family are working, or they're not there, or they live too far away, then you don't get to see them, and it's a real huge wrench. And I do that with psychiatrists and psychologists, because I want them to try and understand what it feels like to be sectioned, to have every single thing that you care about in the world taken away from you, and to be there with nothing, and to stop wondering why people are kicking off over medication or food, because that's all they've got left to kick off over. So it's giving people different shoes to think and see things in. It's giving people different ways to look at what it feels like to actually be sectioned and have all that taken away from you. And I think it's important that we get people who work in these services to just think a little bit differently and be a little bit more kinder and compassionate. I'm not saying they aren't, but just to sort of see what it feels like to have all that stripped away from you.
Absolutely. And we were saying earlier that sometimes perhaps the environment on the psychiatric wards when you're sectioned may not necessarily be that supportive of recovery. And we know some people, when they are very unwell, perhaps they do need the extra support in the hospital, but be mindful of the patients who are there, and what they've left behind, what's happened in their life to have brought them to there that day, and just be kind and compassionate in our communication and talk to them, not at them.
Yeah. Well, I mean, I was 27 before I realised what my dad had done was abuse. To me, that was just a normal environment, and it was ridiculous that somebody would think that what my dad done was wrong. All dads did that to the daughters, and it was just normal. It was just the way it was. So it took a lot to help me understand what abuse actually meant. And
you also sent me one assignment from your master's degree, which was an assignment on an essay on leadership. And although you've been viewed as a leader, because you're doing talks everywhere, and you've been referred to as a leader, but you felt really uncomfortable about it. And can you kind of talk us through why that was?
Well, to me, leaders were people like my dad and my ex. They were people of authority. They were people who took charge and who told people what to do. And it was the first module of the leadership, because everybody kept saying, you're a leader. I often felt it was an insult. I was really upset by them calling me a leader. And I was like, no, I'm not. I'm just there with everybody. I want to bring everybody. I'm not in charge. I just want everybody to come along with me. They're saying, well, that's what a leader is. And I'm like, no, it isn't. And it was the first module on the leadership where the light bulb moment came on. And I realized they were bullies, not leaders. And it just defined the real point of what leader actually meant. And a good leader is down there with everybody, trying to bring everybody along, and we're all equal and level on the playing, on a playing field, and we're all sort of trying to aim for the same thing, which is happiness and life. So yes, it was a real defining moment to realise they were bullies and not leaders, which is what I'd seen it as. So it's even the language we use. When we talked earlier about suicide and think of your family, it's like, people calling me a leader, and I was offended by it. I was upset by it, because my thought process of what a leader was very different to what the majority of people's. So it's making sure people understand the language you're talking.
Yeah, and we were just saying before we came on live, didn't we, that if people don't understand what we're saying, it's because we're not using the right language for them.
Yeah.
And we should reflect and change the language we use, so that people can understand what we're saying.
Well, I think it's because we're hearing more about expert by experience, and they're certainly getting more in the job field, being put in job situations more, which is great, and I'm a real advocate of that. But we also need to be mindful that, one, they understand the language in the field that they're in. If we're writing policies, we need people with experience to be able to do that. And somebody once said, you won't ask a mechanic to do your hair, and you won't ask the hairdresser to fix your car, which is true. So why do we ask policymakers to write policies without people who've got the expertise on there? Which is fine, but we need there's people with expert by experience to be able to understand that language. We need those people to be able to feel confident enough to say, hang on a minute, I don't. What does that mean? How can we address this? Because you can't put somebody who's had years of experience of the system from the outside on the inside and expect them to know everything that is there. And it's not a case of lowering the language, it's a case of skilling up the people to work at that level, to be able to understand the conversations and to feel confident enough to say, what does that mean? And then if they still don't understand it, I don't understand it again. Just so people understand that this is the way that we need to work in future, is by getting experts by all areas, not just one particular area. But lots of different experts by both lived and educational in the background.
Yeah, absolutely. I wanted to also ask you, actually, going back a little bit, since on your journey of recovery and discovering art and everything that you've been up to in the last 11 or so years, how has your relationship with your daughters and your partner changed?
Well, with my daughters, I still don't think they fully understand suicide. I still think they take it personal. And the thing with suicide, it's never personal in that respect. It's always because the person thinks they're doing the best thing. And I'm reading a really good book, and it's about suicide, and it talks about the reasons why people might do suicide, and not to take it personally, and that the person isn't thinking straight. And I've had to be really honest with them and say, I did it for you, even though they don't feel it. And with my partner, I've had to be honest and say, it's a bit of a joke that I say to him, if I'm not sarcastic to him, I'm going downhill. So he needs to be aware. If I'm taking the mickey out of him all the time, he knows I'm fine. But if I'm quiet, he knows he needs to look out and make sure that, hang on a minute, she's dipping here. How do we deal with this?
And this is so important, isn't it? Knowing the people around us. And when you know about it, you can communicate that. But a lot of people
you don't
may not
always
have
know.
the insight.
No, you
to
don't
know.
always know. You can't always see when you're going down, which is why I've had to tell him what to look out for and the clues and, you know, the sort of, you know, if I'm not sleeping, if this happens, if that happens, and what to do. And, you know, he knows that I might fight against it, but he knows these are the rules, this is the plan, this is what we need to do to protect both of us, really, because that's the thing with mental health. It's not just the person. There's a family, there's a community, there's a lot of other people involved in that one person who's got an illness.
Yeah. And what about your relationship with your healthcare professionals, people who have been caring for you?
I don't really see them anymore. I mean, I see the psychiatrist occasionally. I have a lot of emails with him. He does email and he asks my advice, which I really respect. I think that's good that he asks my advice, you know, but to me it's about seeing people as if somebody's in need of help. And I said this to the psychiatrist because I'd come off all medication and there was an event that was happening. It was the anniversary of my mum's death. And I thought, I'm going to really struggle here. So I said to him, can I have a bit of extra support to help me get over this next stage? And he just says, well, you've had it. Been in services 40 odd years. I've had everything going, sometimes several times over. So I said, so have you given up on me? And he never answered. And to me, that spoke volumes. So the next time I went to see him, bearing in mind you only get 10 minutes, I went to see him, and this normally quiet, meek woman who never usually said boo to a goose was this ranting and raving. Why? If somebody wants help, you should be helping them. Why are you not? And it was 40 years of frustration of the services. And it turned into 50 minutes of me ranting and raving at him, and they kept buzzing through to make sure he was okay. And then they started, because he was ignoring the phone, they started coming out and looking through the windows to make sure I wasn't attacking him or anything strange. But he listened to all what I had to say. And I said, right, I'm going now because I've said all I've got to say. And I remember walking with my hand on, you know, thinking, you might have given up on me, but I haven't given up on myself. And he did listen, and I thought, that's it, I'm going to be struck off now, you know. I mean, I questioned my tablets previously and I was labelled a troublemaker. I'm definitely going to be struck off. But I got another appointment through with him, and I thought, right, I will apologise because I put 40 years on him, and it wasn't him personally, it was just the frustration of the services. And I went in and he says, I just want to apologise for all the bad service you've got. And I just sort of, what? And then he said something that I never, ever heard in my care. He says, what can I do to help you? And I thought it was a trick. I thought he was trying to get me sectioned. I thought he was really going to get me to say something. And then he said, right, you said, you know, the power. And it was only through talking to
that
him.
is so sad.
Yeah.
That for somebody to ask you, how can I help, to be viewed as or thought to be a trick, because you've just never had anyone ask you that question.
Yeah, I didn't know what to say. I didn't know whether to tell him, but then I didn't know because somebody else had always taken the driving seat. So it was like, why is he trying to do this? Why is he trying to trick me? Why is he trying to, you know, make this really difficult for me? And I, sort of in hindsight, I think he was doing his best to try and make amends, to try and change himself as a person, which I do really respect. But at the time, I was full of so much. My mind, it was like, what's he want? Why is he saying that? Is he trying to get me sectioned? And think what you say before you say it, you know, almost sort of having an internal conversation before I spoke to him. But like I say, he's completely changed his thought process. And I respect anybody for doing that. I respect anybody for, you know, admitting, whether it's internally or externally, that they didn't have the answers. And they're not the experts in that respect. There might be the experts on academia of certain labels and, you know, diagnoses, but they're not the experts of people. We're all the experts of ourselves.
Yeah, absolutely. Because, I mean, nobody knows you better than you, right?
Absolutely. Yeah. Nobody's walked my shoes.
Yeah.
Nobody's lived my life.
Mhm.
I wouldn't want them to, but, you know, it is what it is. And like I say, I see things a lot more positively now. I try and look at the positive reasons on it. I wouldn't say I've accepted what's happened to me in the past, but I can't change it. So dwelling on it and being sorry about what happened will not impact that. The only thing that I can impact is how I look and respond going forwards.
Mm-hmm. And looking back, your 30 plus years, 40 years in the mental health services, what did you want from the people caring for you? And did you feel able to ask at any point for the things that you wanted?
No, I didn't know what I wanted.
Mm-hmm.
It wasn't even, you know, recovery was never ever mentioned to me. It just wasn't possible. It was never spoken about. It was never asked about. I was never asked what I wanted or why I wanted it. It was always, you know, this is how it is, and that was that. And like I say, somebody else had always been in that driving seat. They'd always taken me where I needed to be. So I didn't have the knowledge to know what I wanted.
And looking back from when you were 8 years old up until now, how has the mental health service improved, if it has, and where can we do better?
Well, it's improved to some degree that we understand the different complexities and different labels. So when I was 8 years old and had that panic attack, I wouldn't be labelled the same as my mum, who was a domestic violence victim, for example. We'd be very different categories, we'd be sent different places. So it's better in that respect. We're a lot more knowledgeable about mental illness and how it is and how we live with it. I think the struggle is the services are stretched. There's too many people needing services, and there isn't enough money and funding to be able to supply everybody with those services. And that's why I advocate for social prescribing, because the art class that I attended for just short of 2 years in total cost less than 1 year's medication. And, you know, that 1 year's medication didn't count all the services and all the other people that were involved in my family's care at that point in time. And they did social return on investment, and it got to about £33,000 savings on my care alone. Now I'm just one person. If we can replicate that, I'm not saying everybody will have a successful, it doesn't have to be art, it can be sport, you know, any other type of thing. But, you know, if we can give people another outlet, somewhere else to connect, somewhere else to be involved, and, you know, why wouldn't we? Why shouldn't we? And if it's cheaper, that's even better.
Yeah. And sometimes we forget that there are so many other ways to support people, because they are people, they're individuals, they're not a label, not a condition, and one tablet or several tablets aren't necessarily going to be the best thing for them. And, you know, I just want to highlight here as well that since the pandemic, we've, you know, I'm sure that any healthcare professionals here would also agree that we've seen an increase of mental health issues. I've certainly seen a lot more anxiety, and not just in adults, but also in children, teenagers, and low mood, because we're socially isolated during the pandemic. And Linda in A&E has seen a huge increase in suicidal attempts. Yeah, Linda, you've unmuted.
Yeah, Debs, I just, I went through an emotional roller coaster just listening to your story. Thank you so much for sharing it. It teared me up, and it's just wonderful to see a positive ending to it. And I know life is a continuous journey, and it's never an end to it, and we constantly have to work on our mental health or physical health. It doesn't get solved all of a sudden. It's quite personal to me from my work point of view. Also, unfortunately, my cousin committed suicide, and I see what we are doing to our patients every day in A&E, how we are so unequipped, so not ready to offer the help that these people need. And so often we label them and judge them, and we write them off even before we had a conversation. Sitting with them in the interview room, just saying that they're medically fit for discharge, when I well know that they haven't received the mental support that they need, breaks my heart every day. And more than ever, your story is so important, because even what we had in the NHS has been taken away. The waiting time for our patients to see a psychologist, a psychiatrist, is about 1 year, if not 2. After a year, they forget about them, and even maybe forget to call them back. And that pushes people to the unthinkable, to suicide. And we know this too well, but we have no resources to help. And whilst everybody individually would like to do something for them, when they see it, they just know that there's nowhere we can refer them to. There's nothing we can say. The truth is, actually, there is something we can say, and we learned that from you. We can ask always, how can we help? We can give them a cup of tea, and we can just listen for half an hour. And maybe that half an hour sometimes is the only time that they have been able to share themselves.
Not just listen, but to hear.
To actively listen, to sit.
Yeah, it's so important to hear what is being said.
Yes.
And, I mean, when I went for that assessment, I was put on a 19-month waiting list. So when I say art saved my life, it really did. I would not be here today if I'd have had to wait. I was at crisis point. You can't get I still wanted to die. You can't get any worse than putting somebody who's at crisis point on a 19-month waiting list. And at that, when I went for the assessment, there were 7 issues that I needed to deal with. By the time I'd done 19 months worth of art, there was 1. And I keep seeing Jo. Now, I know Jo very well. I'm meeting her tomorrow, actually, so I'll give her a stern talking to, because she can do this. And she's fantastic, is Jo. She's another artist. I didn't meet her through art, I met her through work. We just have a lot in common, and she is fantastic. So it would be great if she could come on and do a talk as well.
We would love to share Jo's story. Not love to, it's a duty to listen to you and to learn from all of you who have gone through it. And here at Afternoon Tea, that's how we actually bonded with Erica, and why Afternoon Tea was created, because we really felt that it's still a patriarchal type of medicine, where we are talking from above down to our patients. And we would love to inspire and encourage all the physicians to really speak with the patient and not at the patient, to listen to them again. Yes, it's hard and it's a busy job. Yes, I have also just done 12-hour shifts all week long, and it is tiring and it's hard, but that's why we are there. That is exactly why we are there. And if we can't listen, then there is no point for us.
And sometimes that might be the only time somebody's had somebody listen to them.
And you know that what's beautiful about it is when I did start listening, when I stopped chasing a career and I started being present with my patients, it has rejuvenated my life. For once, I loved my daily ongoing 10, 12-hour shifts. It really is empowering, not just to the patient, but to the physician. And we all often talk with Erica about why is there such a huge burnout in our physician cohort, is because we are kind of trained to disconnect, to remove humility and humanity from our interaction. And the patient-doctor relationship is no longer existing. And without that, what are we? We are not robots. Even if we are physicians, we are just human who are here to connect with patients. And truly, when I have started connecting with my patients, my whole being, my mental health, my everyday has truly become a pleasure. And it's patients like you who continue teaching us this wonderful wisdom that you can teach us more than any textbook. Thank you so much.
Well, when on the beginning bit, when I said everybody's got something to bring to the table, even if it's just themselves, we can learn so much from other people, and we must still keep doing that.
That we need to bring you back to further afternoon teas if you have the time and the passion. And Joe, please do join us, because we need to share this message now more than ever. After the lockdown, unfortunately, even those who have never experienced suicidal thoughts, they are really losing the will to live, because loneliness is killing our communities, our patients, our loved ones, and teaching us, and hopefully bringing a new tone to our NHS and how we are practicing. It's something we can start like you did, one person at a time, but you created a wave in an ocean. So thank you so much for that. May I ask you, Deb, what are the 3 short takeaways that our listeners can implement in their lives right away if they're struggling or if their family and friends are?
To talk to somebody is the first thing, to open up that conversation, to just let somebody know that things aren't as great as what it might appear to be, because we're all good at putting masks on. We're all good at pretending that we're better than we actually are. The second is to connect with your social prescribing link worker. I know I'm biased, but creativity really is such an advocate in mental health. It really gets people to use a different part of the brain, so they're not stressing as much. And I suppose the third is to accept that sometimes you might never be recovered, but that's okay. You can still live a good life. You can still live well. I'll never be recovered. I've always got my labels, but that's all they are to me. They don't define me. I'm me. I'm an artist. I'm Deb's. I'm a mum. I'm a partner. You know, I'm lots of things. I'm not just a service user, and neither is anybody else.
That's beautiful. Well, wow, time has flown, and I would like to thank everyone today for joining us. If you would like to continue this conversation with us, you can join our free membership on afternoonteawithdocs.com. Say hello on our social with the hashtag of Afternoon Tea with Docs. And we would love to hear how you're doing. How are your families doing? How did lockdown affected you? And also, what could we do differently in the NHS, in your opinion? We can learn from everyone, and everybody has a voice, and we would love to hear Joe's voice in one of our next sessions. So thank you so much for joining us today, Deb. We will go on to our non-recorded session after this.
Okay.